Stop everything, Africa. The earth is quaking beneath our feet, and the epicenter is Burkina Faso, the land of upright people. In a move so bold, so earth-shattering, it has left the continent and the world speechless. Burkina Faso, under the indomitable leadership of Captain Ibrahim Traoré, has just pulled off a feat that will echo through history: the country's first ever successful kidney transplant. Hear me loud and clear. On Tuesday, July 29, 2025, at the Tengendogo University Hospital, CHU, in Ouagadougou, Burkina Faso, doctors, alongside Turkish medical experts, performed a medical miracle that has turned impossibility into reality. This isn't just a surgical triumph. It's a blazing middle finger to every African leader who has abandoned their people to die while chasing Western hospital beds. It's a thunderous rebuke to neo-colonial powers who thought Africa would forever kneel. And it's a radiant beacon of hope for every African dreaming of a future where their lives are valued, their talents unleashed, and their nations sovereign. Let me say it again, with the force of 1,000 drums, Burkina Faso has successfully completed its first kidney transplant. This is no minor headline. For decades, Burkina Faso citizens with end-stage renal disease, ESRD, faced a brutal choice: scrape together life savings for exorbitant treatment abroad or surrender to death's embrace. The average Burkinabe, surviving on less than $2 a day under the scorching Sahel sun, could only pray for a miracle. But Captain Ibrahim Traoré, a 37-year-old revolutionary whose name now reverberates like a battle cry across the continent, has delivered that miracle. As Dr. Robert Lucien Jean-Claude Cargougou, Burkina Faso's Minister of Health, declared during a press briefing on July 30, 2025, this historic breakthrough is the fruit of the unyielding vision of His Excellency Captain Ibrahim Traoré, who has made it his personal mission to save lives, rebuild our health system, and restore dignity to our people. This is a moment to stand still and marvel. Burkina Faso, a nation once shackled by underfunded hospitals, colonial exploitation, and systemic neglect, is now performing kidney transplants. Just 3 years ago, patients with kidney failure were airlifted to Turkey, India, or Europe, if they could afford it, while others perished in despair. Rural mothers lost children to treatable illnesses because the nearest clinic was a distant dream. Today, under Traoré's fearless leadership, Burkina Faso is not just surviving, it's soaring, daring to dream bigger than ever before. This is a revolution, brothers and sisters, and it's sending shockwaves across Africa, exposing the failures of corrupt leaders and challenging the West's stranglehold on our continent's destiny. Captain Ibrahim Traoré is no ordinary leader. He's a liberator, a modern-day Thomas Sankara, whose every action screams, "Africa for Africans." Since seizing power in a coup on September 30, 2022, Traoré has waged a relentless war against the injustices that have crippled Burkina Faso's healthcare system. When he took the helm, the situation was nothing short of catastrophic. Hospitals were crumbling relics of colonial neglect, understaffed, under-equipped, and riddled with corruption. Patients with chronic illnesses like kidney failure faced hospital bills that could bankrupt entire communities. A single dialysis session could cost a family their land, their livestock, or their future. In rural areas where 70% of Burkina Faso live, access to emergency care was a fantasy. The elite, meanwhile, jetted off to Paris, London, or Dubai for treatment, leaving ordinary citizens to die in agony. Traoré looked at this betrayal and roared, "No more!" His first act was to slash hospital bills, making healthcare a right, not a privilege. Dialysis, once a death sentence for the poor, is now heavily subsidized by the state. Chemotherapy, previously reserved for the wealthy, is within reach for ordinary Burkina Faso. In 2023, Traoré's government introduced a universal healthcare subsidy program, ensuring that no citizen chooses between food and medicine. This alone is revolutionary in a continent where healthcare is often a luxury for the elite, leaving the masses to suffer in silence. But affordability is only half the battle. Traoré knew that healthcare must reach every corner of Burkina Faso, especially the rural heartlands. In a move that stunned skeptics, he launched mobile hospitals, state-of-the-art medical units that roam the Sahel, bringing life-saving care to remote villages. These aren't just ambulances, they're walking hospitals, equipped with diagnostic tools, surgical suites, and emergency response teams. Picture a grandmother in a northern village, struck by a sudden illness, now treated on the spot by a mobile hospital. Imagine a child saved from malaria because a medical team arrived in time. These units have slashed rural mortality rates by 20% in 2024 alone, according to the Ministry of Health. They're a lifeline for the forgotten, proving that no Burkina Faso is too remote to deserve care. Mobile hospitals are just the beginning of Traoré's audacious vision. He's not content with stopgap measures. He's building a healthcare empire to rival the West. In February 2025, he unveiled plans for 55 modern hospitals across Burkina Faso, a project so ambitious it silenced critics and ignited hope nationwide. These aren't makeshift clinics. They're cutting-edge facilities with MRI machines, intensive care units, and specialized departments for cardiology, oncology, and organ transplantation. The crown jewel is the 500-bed National Hospital under construction in Ouagadougou, set to be one of West Africa's largest and most advanced medical centers by its completion in 2026. This hospital will serve not only Burkina Faso, but also patients from Mali, Niger, and beyond, positioning Burkina Faso as a regional hub for medical excellence. The kidney transplant at Tengendogo University Hospital is a glimpse of this future. Performed by Burkina Faso doctors trained in Turkey with support from Turkish experts, the operation was a masterclass in skill and collaboration. Dr. Eyüp Kaveci, president of the Turkish Organ Transplant Foundation, announced that the project aims to establish a sustainable kidney transplant program in Burkina Faso, with the first 10 operations fully funded by the government. This is sovereignty in action. Burkina Faso doctors performing world-class procedures, reducing dependency on foreign hospitals. The era of airlifting patients to Europe is over, and Traoré is the architect of this transformation. These hospitals are more than buildings, they're symbols of defiance. For too long, African nations have been forced to rely on Western medical systems, with elites flying abroad while ordinary citizens languish. Traoré has rejected this dependency, building a healthcare system that rivals those in London or Paris. The kidney transplant is proof that Africa can master complex procedures without begging for Western approval. It's a declaration that Burkina Faso lives matter, and that African talent, when nurtured, can shine brighter than any imported expertise. Traoré's brilliance lies in his holistic approach. He knows that hospitals, no matter how advanced, are useless if people can't reach them. In a country where rural roads were once little more than dirt tracks, he has launched an infrastructure revolution, building 3,000 to 5,000 kilometers of roads annually. These roads are not just pathways, they're lifelines connecting remote villages to hospitals, schools, and markets. A pregnant woman in labor can now reach a hospital in hours, not days. A farmer injured in the fields can be rushed to a mobile hospital or regional center. In 2024, these roads connected over 300 villages to the national grid, reducing maternal mortality by 15% and child mortality by 12%, according to UNICEF data. These roads are transforming Burkina Faso's economy as well. Farmers can transport crops to markets, earning enough to afford medical care. Traders can move goods without fear of getting stuck in mud. Children can attend schools near hospitals, ensuring they grow up healthy and educated. This is what leadership looks like. Not empty promises, but tangible results that touch every life, from the bustling streets of Ouagadougou to the quiet villages of the Sahel. Traoré's revolution is not just about saving lives. It's about building a future for Burkina Faso's youth. His healthcare and infrastructure projects have created tens of thousands of jobs for young Burkina Faso, from doctors and nurses to engineers, road workers, and hospital administrators. The kidney transplant team at Tengendogo included young Burkina Faso surgeons trained in Turkey and mentored by Turkish experts. Traoré's investment in education has sent hundreds of students to study medicine, engineering, and technology abroad, with a mandate to return and serve their nation. In July, Traoré made global headlines by donating his own blood, urging citizens to join him in saving lives. This wasn't a publicity stunt, It was a call to action from a leader who lives his values. Where else in Africa have you seen a president roll up his sleeve to give blood for his people? This act inspired thousands of young Burkinabe to volunteer at blood drives, creating a culture of solidarity. Traoré's policies have given youth not just jobs but pride, a sense that they are building a nation worth celebrating. No longer must they migrate to Europe or beg for scraps in foreign lands. They are the architects of Burkina Faso's renaissance. Now, let's confront the ugly truth. While Traoré builds a healthcare revolution, many African leaders have turned healthcare into a nightmare. Across the continent, hospitals are crumbling, understaffed and under-equipped. In Nigeria, public hospitals lack basic supplies like oxygen or bandages, yet former President Muhammadu Buhari spent months in London for treatment. In Zimbabwe, the late Robert Mugabe flew to Singapore for checkups while his people died of cholera. In 2025, this betrayal continues. African elites jet to India, Europe, or Dubai for minor ailments, leaving their citizens to die in dilapidated clinics. This is not just negligence, it's treason. African leaders have looted healthcare budgets, siphoning off funds meant for hospitals to build mansions, buy private jets, or stash money in Swiss banks. In Nigeria, billions allocated for healthcare have vanished into corrupt officials' pockets. In Kenya, the Mafia House scandal saw politicians divert millions meant for medical equipment to offshore accounts. In South Africa, corruption during COVID-19 left ventilators undelivered and hospitals overwhelmed. These leaders attend global health summits, begging for aid while their people die of malaria, tuberculosis, and childbirth complications. They call in expensive Western doctors to treat them in their palaces, ignoring African doctors who could outperform them if given the chance. The kidney transplant in Burkina Faso is a stinging rebuke to these leaders, a reminder that African medical professionals can achieve greatness when supported. It exposes their failure, shaming them for prioritizing personal gain over their people's lives. If Burkina Faso, a landlocked Sahel nation with fewer resources than Nigeria or Kenya, can perform a kidney transplant, what's their excuse? Africa is not poor in medical knowledge or talent. From the traditional healers of Mali to the herbalists of Ghana, the continent has a rich history of medical innovation. For centuries, African medicine saved lives, treating wounds with herbs, managing childbirth with ancient wisdom, and curing ailments with the plants. Western science is only now beginning to study. Yet, colonial powers and their modern successors have convinced Africans that their traditional medicine is backward, pushing them to rely on expensive Western drugs and treatments. Traoré is shattering this lie. His government is researching traditional medicine, integrating it with modern practices. In 2024, Burkina Faso launched a pilot program to train traditional healers in modern diagnostics, creating a hybrid system that respects African heritage while embracing innovation. This is a model for the continent. Imagine an Africa where Nigerian surgeons share expertise with Burkinabe doctors, where Ghanaian herbalists collaborate with Kenyan pharmacists, and where South African researchers develop vaccines alongside Ethiopian scientists. If African leaders follow Traoré's lead, the continent could become a global healthcare leader, with Westerners flocking to African hospitals for treatment. But this requires unity and courage, qualities Traoré embodies, but too many leaders lack. Through the alliance of Sahel states, Traoré is building a coalition with Mali and Niger, sharing resources and expertise. This is Pan-Africanism in action, a vision of a united Africa where knowledge and wealth are shared for the benefit of all. If only other leaders could abandon their greed and join this movement, Africa would rise as a medical powerhouse. The West is quaking, and they have every reason to be afraid. Captain Ibrahim Traoré is dismantling their neo-colonial grip on Africa. In 2023, he expelled French troops, ending decades of exploitation. He nationalized Burkina Faso's gold mines, building a $1 billion gold refinery to fund healthcare, roads, and education. His partnerships with Russia and Turkey are based on mutual respect, not subservience. The kidney transplant, supported by Turkish expertise, is proof that Africa can forge alliances without bowing to the West. Western media have launched a smear campaign against Traoré with lies like US General Michael Langley's claim that he's hoarding gold for personal gain. But the Burkinabe people see through this propaganda. On April 30th, 2025, thousands rallied in Ouagadougou, chanting, "Their lies won't touch us. Colin Powell lied. Iraq was destroyed. Barack Obama lied. Gaddafi was killed. But Traoré stands tall." His rejection of IMF and World Bank loans, which trap African nations in debt, threatens Western hegemony. His success shows that Africa can thrive without their aid, which often comes with strings that choke sovereignty. Africa, this is your wake-up call. Captain Ibrahim Traoré is not just Burkina Faso's leader, he's a pan-African icon, showing what's possible when leaders prioritize their people. His healthcare revolution, mobile hospitals, modern facilities, affordable care, roads, jobs, and now a kidney transplant, is a blueprint for the continent. While corrupt leaders beg for Western scraps, Traoré builds a nation. While they fly to Europe for treatment, he donates his blood. While they divide, he unites. The kidney transplant is more than a medical milestone. It's a rallying cry. If Burkina Faso can do this, so can Nigeria, Kenya, Ghana, and every African nation. Unite, invest in your people, and reject the West's lies. Traoré's Burkina Faso is proof that Africa lacks nothing except leaders with his courage. Rise, Africa, and let the shockwaves from Ouagadougou ignite a new era of pride, power, and possibility. The time for excuses is over. The future is now, and it belongs to us. The historic kidney transplant performed on July 29, 2025, at Tengendogo University Hospitals under Captain Ibrahim Traoré's transformative leadership is more than a medical breakthrough. It is a blazing indictment of failure, a blueprint for empowerment, and a challenge to global dynamics. This singular achievement in Burkina Faso, a nation rising from decades of neglect, holds profound lessons for corrupt African leaders who flee to foreign hospitals, for African citizens yearning for change, and for Western powers accustomed to dictating Africa's fate. As Burkina Faso carves a path of self-reliance and dignity, it demands reckoning, action, and respect from all corners. African leaders who board private jets to seek treatment in Europe or Asia while their citizens perish in dilapidated hospitals must face the stark truth revealed by Burkina Faso's success. Captain Traoré's commitment to building a healthcare system that serves every Burkinabe, regardless of status, exposes their cowardice and greed. These leaders must learn that true leadership is rooted in accountability,